Hi, I'm Dr. Victoria Aimé. I'm a plastic surgeon in Scottsdale, Arizona. One of the questions I got asked recently was how much is the pectoralis function affected when we place breast implants underneath the muscle or subpectoral plane? Because during that operation, typically we do cut a portion of the muscle. When we place a submuscular breast implant, we cut the lower portion of the pectoralis muscle. So the pectoralis muscle is kind of like a fan. So it's basically like this, connects along the clavicle and along the sternum in the midline here. When we contract, it helps pull our shoulders inward. When we place a breast implant underneath it, what we do is we actually cut a portion of this along the bottom down here and a little bit along the sternal edge, and we place the implant underneath it. Now, from our studies, what we've seen is that there is typically a temporary decrease in pectoralis function at somewhere between 3 and 20% for most patients. It affects mostly your ability to adduct or adduct, which is moving your arm towards your body at the shoulder level, and something called internal rotation, which is actually turning your shoulder inward. So those are functions that your chest muscles help you with. Now, patients will often compensate this with other muscles that are around the shoulder girdle, especially with time. So they will learn how to basically function and not particularly need this function from the pec muscle as much. So typically it doesn't affect your daily activities very much unless you are an avid athlete, somebody who is like a power lifter, you're doing a lot of push-ups, you're doing chest press, you're a rock climber, things like that. Those patients may notice more of a decrease in their function than other patients who are less active. And we also know that placing the breast implants underneath the pectoralis muscle does cause some atrophy, is one thing to note as well. It is not to say that this pocket can't be used, it's just that there can be some temporary decrease in function that typically is compensated for long term. And so most patients really don't notice a big difference in their chest strength, but it is something that we have studied in the plastic surgery literature. So excellent question.